Welcome. I'm Maggie Fox, consulting editor to WebMD and Medscape, and I'm here with Dr. Eric Topol, editor in chief at Medscape. We're talking about long COVID, which affects at least 13% of people after they've been infected with COVID, according to the US Centers for Disease Control and Prevention. That adds up to millions of people who could be affected by severe fatigue, heart symptoms, brain symptoms known commonly as brain fog, and a range of other problems. There's no specific treatment, and it's not clear how long some of these people will be sick. Yet Americans in general appear to have largely given up on protecting themselves from COVID. And Dr. Topol, I wanted to talk to you about that. Is that something people should be thinking about when they're deciding what their own risks are?
Well, first, Maggie, great to be with you, and particularly on this important topic. Long COVID is not getting nearly enough regard of its importance, and as you mentioned, the lack of any treatment. So it's a really vexing situation where we have millions of people, and we don't have anything to offer except supportive type things. And I think the real issue here is that at the moment, we aren't doing enough to give the recognition to these people that this is, a serious matter that we want to avoid. I mean, the only way to avoid long COVID is not to get infected, or if you've had COVID, to not get infected again, because there's still risk, even if you've had a prior infection. So we don't have this notion, like, for example, right now, why should you go all out to keep yourself protected? You don't want to get this. And the problem is unpredictable. It's, chiefly in people with mild to moderate. People in their 30s and 40s are particularly the group that are showing up with these protracted symptoms. As you mentioned, Maggie, they can be quite debilitating. So everything we know about this, the unpredictability, the lack of treatment, and the fact that there's only one surefire way of preventing it, which is not to getting infection. The vaccine protection, booster protection, there is some, but it's not entirely clear if it's 50% or less or more, but there is some protection. And that's another reason to stay up with vaccines and boosters.
So what I hear you saying is people can't predict if they're going to be the ones who get long COVID or not. Being young and healthy doesn't protect you.
Right. I mean, I haven't had COVID and I don't want to get COVID, because right now I'm not as afraid. I mean, I'm an older person, but I'm not as afraid of dying from it or even the hospitalization as I am of getting long COVID, because it's unpredictable and we don't really know. We know a bunch of the triggers for our immune system going haywire. Like there could be persistence of the virus in reservoirs in our body, or remnants of the virus, or autoimmunity that's set off by the infection. We know some things of the biology of this condition and how it resembles myalgic encephalomyelitis, chronic fatigue syndrome. We know that much. But the problem is it's a roulette wheel. If you get the infection, are you going to wind up, even if you start getting better days later, you could a month later start getting the symptoms. And that's what is so unpredictable.
And these symptoms can be really debilitating, right? You don't just feel a little sick. Some of these people are very, very fatigued, can't think straight, can't exercise at all. What are some of the symptoms people have that you know about?
Well, I have not only colleagues, but patients who I'm following. And it's just remarkable how bad this can be. I mean, some of the people that I get to work with are young in their 30s that were athletes, and now they can barely walk a block or two, and they're just so profoundly tired, and they have assorted symptoms like chest pain or joint aches or severe headaches, and as you mentioned earlier, brain fog, and there's about 50 different symptoms that are part of the mosaic. It seems to separate into two different major categories. One, which is the immune system that is related to symptoms that were just mentioned. And the other is more peripheral nervous system inflammation, that is this dysautonomia, where people, when they stand up, all of a sudden their heart rate really takes off to, 100, 120 or more, and they get lightheaded. And that's holding them back. So that seems to be more of the peripheral nervous system, whereas the more generalized inflammation is perhaps more common. But no matter which way you go, it can be highly compromising to be able to do your daily activities, no less to work. And there's people who I know who got infected, March or April of 2020, who now 2.5 years later are still suffering. They may have had some improvement, but they're still suffering. So this is the problem: is that it's a very serious matter, and we're not making the progress that we need to try to come up with remedies. We don't even have a biomarker to be able to assess the improvement through objective data and tracking. So, we're still way behind.
So this sounds like a very serious condition that people should be thinking about, but so many people seem to be willing to give up in general on the threat of COVID, even the threat of acute COVID. Why is that? Is this a messaging failure? And if so, whose failure is it?
Well, I don't know. I mean, I think the one thing is the rate has gone down with the Omicron variants. So whereas it was clearly in double digits, it appears to be more in the 6%, 7%, whereas it had been, 12 to 15%, like the CDC statistic you came. So the frequency of knowing people, family members and friends and persons network that are affected is less in recent times, over the past year. And that may be one of the reasons where the consciousness, the awareness is not as high. Also, because a lot more people are vaccinated and staying protected with boosters, that does help. It may not only reduce the incidence of long COVID, it may reduce the severity or hasten the recovery. So it may just be, Maggie, part of the fact that it's less of a threat than it was earlier in the pandemic, but still a major threat. I mean, if you take 6% of people or whatever it is with the current variants, it's still a lot of people that are getting hit. But otherwise, we have not done nearly as well as we should with the awareness. We know, of course, many places around the country have set up long COVID clinics, multi-specialty clinics, but they can't possibly serve the huge burden of people who are suffering now. Some will improve, some will get fully recovered, of course. A big study nationwide through Scotland showed that, a limited number of people have full recovery. Most of them, even at several months out, did not recover. 40-some% did not recover fully between 4 and 6 months out. So that gives you a sense of how long this can last. And I wish we were making more progress.
So you're painting a picture of millions of people possibly affected. They're sick for a long time. Do you worry about the risk of having millions of people affected by long COVID, perhaps for years, unable to work or only able to partly work?
Yeah, I think this is the long tail of the pandemic, the long residual is this component. I mean, people have focused on deaths and hospitalizations as the severe outcomes throughout the pandemic, only because we didn't tally the people. We didn't prospectively get data about recovery from the acute illness. So if you go forward, as we get further and further along in the pandemic and eventually achieve containment of the virus, what do we have to look forward to? Well, unfortunately, this is the sobering reality, is that we're going to have millions of people who are still in one way or another having these enduring, very troublesome symptoms. And hopefully before long, we'll come up with treatments that will reduce the toll, help hasten the recovery. We desperately need that. The U.S. has put in more than $1 billion in NIH to come up with treatments. Hopefully they're going to click at some point.
Are people hearing that message, though, perhaps, and thinking, well, even if I got long COVID, they're working on it and I'd be cured at some point? Could that be playing into the psychology?
I don't think so, because if you talk to the folks who are affected and they're so strongly compromised, many from what their baseline was pre getting COVID, long COVID, that they would not think in those terms, that there'll be a treatment, so it's okay. I think it's very clear that this is a group of people who wish they never had to experience these symptoms and are eager to get back their lives and full ability to function.
So what's the message to people who haven't gotten long COVID yet, or haven't even gotten COVID yet? What would you tell them about their risk?
Well, first, I think it's been exaggerated that everyone's going to get COVID. That, I think, is notion I want to debunk that. Not everyone has to get COVID or get COVID multiple times. That's a defeatist attitude. You still can protect from getting COVID. I mean, there's simple things you can do, whether it's high quality mask and being careful about, indoor settings and groups and that sort of thing, but also getting your vaccines and boost as much as you can to stay maximally immune protected against the virus. So we're not doing that in general because, in part, as you got into, Maggie, the long COVID awareness is not nearly as high. It's not taken nearly seriously enough. It is by the people affected, but not by the medical community or the general public. So we hopefully are going to change that over time. And that will motivate people to be much more careful, much more cautious, and not this defeatist attitude. Oh, I'm going to just get it. I'm not going to worry about protection of things that I can do. We know those things work.
And people who say, well, I've had it once, it wasn't so bad, so I'm not so worried about it. Again, with the long COVID, people don't know if maybe the second or third time they're infected, that's when they'll get long COVID.
That's right. Just because you've had it before doesn't mean you're still not susceptible. And that's something to emphasize, because there is a percentage who've never had COVID. And then there's all those people who've had an infection. They think they have a false confidence that this premise that, oh, well, they're protected from getting long COVID. It's not true. Not true at all.
So what would your final message be to not only the physician community, but to the community in general?
Well, it's time to really gear up the awareness, the respect, the empathy for people who are suffering, and that we have to be supportive as much as we possibly can and do whatever we can to accelerate effective therapies. I'm confident that we will get to the bottom of this, but it isn't going to be soon enough. I mean, we're so far along in this pandemic when people were first getting hit with long COVID in spring of 2020. And here it is approaching winter of 2022. And we have nothing that's been validated. We've got to rev this thing up and, come up with treatments. We'll probably do better, quicker on the dysautonomia, because there's things in the pipeline that appear promising, than we will on the mosaic of immune symptoms that are central nervous system. But we've got to do everything we can to aggressively pursue effective therapies.
Dr. Topol, it's such a pleasure speaking with you. Thanks for joining us today to talk about this.
Thanks, Maggie. Hopefully we'll make some progress here.
Let's hope.